My name is Joanne Fisher, and I'm going to show you how to take vital signs of a person, a patient, a loved one, using equipment that you can find over at Costco, Sam's Club, or even at Walgreens or CVS. These are common devices that you can find. So this is called a pulse oximetry. This is called a thermometer. And this is a blood pressure cuff that automatically does the reading for you. So I have my lovely assistant, who's my daughter, who will be our subject for today's video. So the first thing we're going to go ahead and do, we'll do the temperature, where you're going to hold down the button as you place it onto the forehead. You want to make sure you hit the forehead. And the last place that you're going to end up is right here at the temporal areas. That's the area that you want to make sure that the temperature is measured. So you start on one end, hold the button down, run it across, and then lift up. And she's at 99.3. Not a full fever yet. Then, next thing we'll do is do her pulse oximetry, which will check her oxygen level in her tissue, and then also her pulse. So how many beats her heart is beating per minute. So it's upside down. So right now it's at 97%, 97% out of 100%, which is good. And she has a heartbeat of 76, 78 beats per minute, which is normal. The last thing we're going to show, I'll get hold on to that, is the blood pressure. So when you look at the blood pressure machine, you want to make sure that everything is plugged in well, that there is a line on these machines, and you want to make sure that the line is on the inside part of the arm. The other thing you also want to make sure is that the cuff is the right size. You would not use this on a child because it would be too large. Or you don't want to use this on someone who's much bigger, maybe a 6'5" person, so that won't fit that person. So we'll place it onto her arm. That blue line is on the inside. Make sure that it's on nice and snug, and all you have to do is hit on, and it'll go ahead and measure her blood pressure. You can hold it so relax your arm, and you want to make sure that their arm is relaxed so that it's not tense, because it will alter the reading. So how was your day today?
Not too bad.
Not stressful?
Nope, not at all.
So normal readings for blood pressure, depending on the age, usually for like 16 and older, 120 over 80 is normal. Anything below that would be considered hypotensive or low blood pressure, but it depends on the person, because each person can have a low blood pressure or it can be hypertensive. So usually anything over 135, over 85 or 90, those would be considered a little hypertensive. So if you can see here, her numbers are 122 over 90, which is somewhat normal, but it's that lower blood pressure that's 90 that is a little bit elevated. And her heart rate coincides with what was found on her pulse oximetry, which was 78. So her heartbeat is 78. So these are some easy steps that you can take to take your loved one's vital signs so you can gauge how well or how poor they're doing. Thank you.